Do you have significant memory loss of specific times, people, and events? Out-of-body experiences such as feeling as though you're watching a movie of yourself? Mental health problems that include depression, anxiety, thoughts of suicide, maybe a sense of detachment from your emotions, or maybe you just have emotional numbness. Maybe you have a complete lack of self-identity. If you're watching this, or someone said this to you, chances are pretty good you or they think you have D.I.D. So there are 3 types of dissociative disorders defined in the Diagnostics and Statistical Manual of Mental Disorders, or the DSM. First is dissociative amnesia. The main symptom is difficulty remembering important information about yourself. Depersonalization disorder, and also dissociative identity disorder. To be diagnosed, you need to have at least one of these 3 kinds of patterns. So for dissociative amnesia, you kind of sort of remember your childhood, but on any given day, you can't remember specifics like normal people remember. So you can see the house you were babysat in, but maybe you can't see the layout or the yard. Maybe you can't even see the babysitter. Or maybe you got in trouble at one time for disappearing somewhere, but you could have sworn it was only a couple of seconds, maybe a minute, and everybody else just knew that you've been gone for like half an hour or longer. Then there's depersonalization. So that starts usually around 16, and you start noticing that maybe you felt like you were living in a movie. You started seeing yourself, but it felt like it was all from the outside. Maybe it wasn't constant. Maybe it just happened once in a while. Maybe it only happened once or twice. But you know for a fact that it was the creepiest thing ever. So according to the National Alliance on Mental Illness, less than 20% of people with this disorder start experiencing episodes after the age of 20. Then there's dissociative identity disorder. Women are more likely to be diagnosed than men because men tend to hide their symptoms and try to hide the history of abuse or trauma that is needed to prompt this disorder. But this used to be called multiple personality disorder, and its symptoms combine dissociative amnesia and depersonalization disorder. Plus, you get the added bonus of having alternate personalities that seem to randomly change your control and your behavior. So what do all these have in common? Well, they all tend to result from having a screwed up childhood or some sort of major mishap when you were under 5. So if you think that you or someone you know has D.I.D., here are 5 things you need to know. 1. D.I.D. doesn't get worse. 2. No 2 cases of D.I.D. are alike. That means just because your story or symptoms sound like someone else's doesn't mean you have D.I.D. Of course, if you think you may, you need to get diagnosed. And only a psychiatrist, preferably one who's seen D.I.D. before, is best equipped to tell you if you do indeed have dissociative identity disorder. So don't self-diagnose. Not everything on WebMD is cancer. Also, 4. It's not your fault. This is caused by childhood trauma or incident, or may or may not be related to something someone else caused or did to you. 5. There is no treatment and management that will give you a cure. The goal of most medicines and therapeutic approaches here is to reintegrate your memories or alts. This may or may not happen, and we'll discuss these treatments, tools, and tips in other videos. And if you do have it, you'll be fine. Welcome aboard the D.I.D. bus. Leave questions and comments down below. For more info, hacks, and fun stuff, see us on Facebook, Twitter, or at girlinabus.com. And of course, subscribe so you never miss our awesome videos.